Hello, good morning, and welcome back to another episode of 10 a.m. Tea with Natalie. It is 10 a.m. Pacific, 1 p.m. Eastern, and I hope that your Wednesday is off to an awesome start and that your week is going well and everything's going according to plan for you. Yesterday, we talked about how you know if you're healthy enough to start an exercise routine. So basically, if a doctor ever told you, you have to be really careful and to check in before you start anything, definitely do that. If you have a history of some kind of significant health issue or some significant injury, please check in with your providers. That's kind of the rule of thumb. However, having a history of injury and things does not mean that you don't never have to work out again. That's not realistic. That's not good for your body. So it's about finding the activities that are going to be meeting your needs without causing damage. So how do you approach starting an exercise routine from being sedentary or just being a couch potato? It can be really, really intimidating. You have a lot of potential for injuring yourself. You have a lot of potential for hitting roadblocks and things. So really, really going slow and steady is super duper important here. I recommend starting to increase your light exercise. So do a little bit more walking, farther than you usually would. Park a little bit further away. If you usually, drive down to the corner store, maybe walk down there and see how you do. Use a step counter and just keep track of how many steps you're taking on average to get a baseline for, where you are right now. Logging your daily activity levels can really give you a good sense of, where you are on the fitness spectrum and help you make plans and goals to incrementally increase that aspect there. So how often or how little are you working out? The goal is 150 minutes of moderate exercise per week, which it breaks down to about 30 minutes 30 minutes a day, 5 days a week. You could also look at potentially high intensity exercise. Last week we talked about the increased risk of injury there, so that's something to consider. But high intensity exercise would be something that you would do maybe for 15 minutes a day, 5 minutes a week. So if you're starting out at I walk for 5 minutes a week, then definitely you're not going to be headed towards 150 minutes your first week, back in an exercise routine. That's not really realistic. So basically where you're starting is just kind of getting a log of where you are. And then look at potentially increasing things week by week and day by day. So start counting your steps. Don't worry about your heart rate. Don't worry about, calorie burn and different things. Just start by being active and keeping it simple. So work towards 10,000 steps a day. This is going to be something that's intentional. You're not going to accidentally do 10,000 steps a day. Okay, this is something that you're going to be consciously thinking about. How can I get more steps in order to reach that goal? It's also really important to note that if you're reaching 15,000 steps a day, those patients have no risk of heart disease. So 15,000 steps a day is really the gold standard as far as making an incredible difference in your health and well-being. But every step counts. So, don't not start because the thought of getting there is too overwhelming and too looming. Because that's, not a reason to give up on yourself. It's because it might be hard. Usually those are things that you should be working towards. So start counting your steps and make sure that you're using the right equipment. So that means good shoes, good socks. Listen to what your body is telling you. If your feet are aching at the end of your walk, maybe there's something not right with your shoes. Maybe there's something out of alignment with your hips. Make sure that you're doing your stretching. Every 15 minutes or so of exercise, give yourself a little pause. Stretch out your calves, stretch out your quads, hip flexors, hamstrings, glutes. Make sure that you are keeping all of those tissues well circulated. That's going to prevent injury. It's also going to prevent soreness afterwards too. So use the right equipment. Make sure that you use insoles if you potentially need to. Good morning, Annie. Thanks for checking in today. Support braces can also be really helpful. So a knee brace, an ankle brace, if you're having a history of injury or soreness there, use those little things to support yourself. That can be the difference between having an awesome workout and feeling like shit after. So, take those little steps. An ACE bandage is incredibly powerful, okay? It helps the joint stay more stabilized. So all the little ligaments and tendons and muscles don't have to work so hard to keep that joint still and keep those bones lined up. It's especially important as we get older, when we're hitting our 30s, 40s, and 50s, that we're taking this into consideration because those tissues just aren't as strong as they used to be. They don't recover as quickly. They don't have as an amazing blood supply as they used to. So it's really important that we're taking those little steps to prevent us from getting an injury there. So you're counting your steps, you're wearing good shoes, you have awesome socks, you have your knee brace on, you're looking gas as you're going down the street. Now what? Now you increase your steps 500 steps a week. So if you're starting out at 500 steps a day, then you go towards 1,000 steps a day. And every week you add 500 steps to your goal, and eventually you'll hit 10,000 or 15,000 steps. So that's kind of a really basic idea for how someone can start from being sedentary to actually getting into a walking routine. So start really super slow. First week or two, just get a baseline for where you are. What are your typical steps? Get some real data there to figure out where you're starting from. And then incrementally build up. Make sure you're using the right equipment. Make sure you're doing your stretching. And also make sure you're drinking lots of water to compensate for the calorie burn and to help your tissues recover more quickly. So coming back again tomorrow, I'm going to talk a little bit more about how to increase from walking towards more cardio impact type activities. And then we're going to talk a little bit about strength training. So there's lots and lots more to come on this whole exercise routine area. So make sure that you're checking in every Tuesday through Friday, 10 a.m. Pacific, 1 p.m. Eastern for 10 a.m. Tea with Natalie here on Facebook Live. If you have any ideas about future shows, or you think that someone else, or if you think that you have a question, comment, concern about something that I'm saying, definitely comment here. You can always interact with the video post live as well. I'm happy to answer any questions that you have, and definitely share on your feed and tag people if you think that they may find this helpful, because there's no reason to die of laziness when it's so easy to just, walk around and get your body back on track. So have an awesome day. Have a glass of water. Take good care of yourself. And I will see you again tomorrow for 10 a.m. Tea with Natalie. See you soon.